Well, thank you very much, Barry, for that. Those opening remarks. You're very much speaking the language of the Arrhythmia Alliance and the Atrial Fibrillation Association. As you know, we're a group that specifically tries to put together all of those people in healthcare that are interested in dealing with cardiac rhythm disturbances, in this instance specifically atrial fibrillation. And we number amongst our members doctors, nurses, members of industry, healthcare professionals, allied professionals, patients, carers, members of parliament, and people from the higher echelons of the administration within the health service. And we're very proud that we can draw all of these people together in order to try and do something good for this very widespread problem of atrial fibrillation. The number now that we know about is about 2% of the population have atrial fibrillation. And as our population ages more and more, that 2% is likely to grow to 4% within the next few years, the next decade or so. And this figure perhaps doesn't mean very much to you. What does 2% of the population mean? Doesn't include me, you might say, but 1 in 4 of us in this room will have atrial fibrillation before we pop off. So remember, look around, see which of your neighbors is going to have the atrial fibrillation and think whether you're going to escape it. So remember, it is a problem. For those of you who are interested, I also have a personal interest in this particular problem because I have atrial fibrillation. So would 3 of you like to join with me so you don't have to get it? Well, I've had it for 30 years, and as you see, I can still exercise a bit, I can still do a few things, I can still go to work. And it is possible, if you treat atrial fibrillation, that the patients who have this rhythm disturbance can lead a totally normal life. But the problem is that we don't pick up all the atrial fibrillation that there is. About 1/3 of those people who suffer from atrial fibrillation are in the community. They know nothing about it. Their doctors know nothing about it. And we must start looking for it. And I think all of you are very aware of the Know Your Pulse campaign that has been set up and pursued by the Atrial Fibrillation Association. We have literally felt millions of pulses, detecting on average something of the order of about 1 to 2% of those pulses which are irregular and which turn out to be atrial fibrillation. In this building, we have felt most of the pulses of the MPs, not many of the House of Lords, but many of the MPs. And just last week, we felt the pulse of one government minister who very surprisingly at the moment had a very steady pulse. But there were 9 other people in the same session who had irregular pulses related to atrial fibrillation. So this is an ongoing campaign. Now, we need to be much more systematic about finding atrial fibrillation. We need to take every opportunity to feel the pulse. And when I say we, I mean doctors, I mean allied healthcare professionals, I mean patients and their relatives and their carers and their families. It doesn't take very long to work out if the pulse is totally irregular or if it's regular. And if it's totally irregular, the message is just go and see your GP and get started on the diagnostic trail so that we can pick this up. The problem is that there are serious consequences to atrial fibrillation. You can develop a stroke, you can develop heart failure, you can die more readily. Suddenly, you can be in hospital much more regularly. You can develop cognitive decline and dementia. All of these are related to atrial fibrillation. Now, there are many patients in this room, and it's possibly very hard to listen to what I have just said. But remember, it's hard for me to say it too. I know very well the consequences of atrial fibrillation, and I say to you that if you're treated properly, these will not be problems that you will develop from your atrial fibrillation. Now, the AF Association was set up in 2007 in October, and at that stage there was no other organization that was devoted to atrial fibrillation. But now around the world there are many. But the Atrial Fibrillation Association and the Arrhythmia Alliance, its sister organization, is the largest in the world by far. It's not just in the UK, it's in Australia, Brazil, the United States, all over Europe, South Africa. It is all over the globe. Our membership exceeds 100,000, at least 60,000 patients and 40,000 healthcare professionals, etc. So we are a very large group, and we are making an impact all over the globe. We work with professional societies, we're endorsed by them, we are asked to contribute by them. So the European Society of Cardiology, for example, the World Heart Federation, for example, the American College of Cardiology, for example, and just at home, for example, the NHS, Public Health England, NICE, we are associated with and help and contribute to all of these organizations when they need an input from us. So I think that we are doing a good job, but it's not yet good enough. And this platform is one that allows me to say to you, do more, do more. Locally, you can talk to doctors. If you are a doctor, you can talk to patients, administrators, and so on and so forth. We must follow the sort of three musketeers creed occur: one for all and all for one.